Hey everyone, I'm Lauren Fleming. I'm the founder of Him Supportwear, and today we have Dr. Loupe. She has over 10 years of experience as a pelvic health and orthopedic physical therapist, treating a wide variety of conditions. She also serves as the birth doula on her clinic's team, and she's a yoga instructor. She's the co-creator of their program Move Through Motherhood, and is a course creator for Pelvic Powerhouse, which offers continuing education for pelvic health professionals. So we are so excited to have you here today, Allie. Thank you for being with us.
Yes, I'm so excited to be here. Thank you for having me.
I'm particularly excited about your background because I had a doula with both of my births, and I'm super passionate about doula and then the role that they can play for people. So I'm extra excited to get to talk to you and have that part of your background and expertise.
Yes, awesome. I'll happily share it. And I'm a little bit of a doula high right now because I was out of birth all night long and got home at like 4 something and took a shower and slept for an hour and then got to work at 7 this morning. And so
All right.
I'm totally running on birth adrenaline right now and coffee, lots of coffee.
Yeah, right. Amazing. I know I feel like the life of a doula is it's so versatile, right? Like your schedule and stuff being on baby's time and all of that
Yes.
is such a special thing. Great. Well, can you tell us a little bit about your background and what inspired you to have, these various roles that you have?
Absolutely. So I did not know that pelvic floor therapy was even a thing when I went into PT school. I went into PT school thinking that I was going to either go into peds or neuro. And it was during my first year of PT school that I was kind of introduced to the idea of pelvic health and pelvic floor therapy. And it was a very, very small amount of information that we're given in PT school. But instantly, I just needed to know more. I was so intrigued by all of it. I was so curious. And also, personally, because I had been struggling with constipation, I had had some history of pelvic pain. And so, um, immediately upon learning about, pelvic floor therapy and pelvic health, I was just like, hold on, I need to know more for myself. But also, this is something that other people are dealing with too. I had remembered hearing issues of like my mom's friends when I was younger. I remember them talking about like not wanting to jump on the trampoline when they were um, like postpartum because they were peeing everywhere. And so I was like, hold on, I need to know more. And so at that moment, that door opened. I like went through that door and have just been like running at pelvic health ever since then and have never looked back. So I think it maybe found me. I don't know that I found it, but yeah, it's been amazing. And then the doula um, role is kind of a newer role. It's been something that I've wanted to do probably for like the last 8 years. I have an 8-year-old, so obviously once I became a mom and had experienced having a doula, it was like opened up that world to me.
Yeah.
But this past year, I had so many of my patients ask me, would you ever consider coming to my birth? Could you be my doula? Like all these questions. And around the same time, our the clinic that I work for, Genesis PT and Wellness, has a couple of other doulas on our team. They were filling up on their schedules and they reached out and said, hey, is anybody else interested in becoming a doula? We have a lot of need for it. And I was like, okay, I guess this is the time for me to add this to my collection of hats. And it has probably been the most just like seamless thing to ever just like come into my life. Like I just feel like this is really I was made to be a pelvic floor PT for sure, but I was 100% made to be a doula. I absolutely love it.
Amazing. That's so cool. When it's so cool, I feel like the more people I talk to in this space who like have found pelvic health, it's comparable, right? Where it's like they have varying levels, of knowledge of it before, but once they hear about it and latch onto it, it is like there is no turning back. There is no question that that is the right path, and it's give me as much information as I can and let me help as many people as I can. And it's so cool to see just like that tangible passion for people in this space. And then amazing on the transition to include the doula, like you said, the doula hat to your assortment of hats. That is so, so neat.
Yeah, it was just it was natural too because I'm kind of already in this world, and so it was a very easy thing to like segue into. And then to be able, so my goal is that most of my dual clients will also be my pelvic health patients. So it'll be really neat to be able to see them in their pregnancy or maybe even when they're trying to conceive and
Mhm.
then get to be there with them during birth. And then again, be able to follow through
Postpartum.
postpartum with that recovery. And so just to be there for the whole season is, I think, really cool.
Yeah, well, I think it's amazing, and especially in like with practices like yours, where women are getting to spend a lot of time with you, and then you become such a trusted resource. And I feel like it's like a trusted resource, the confidant, and like having that additional person beyond, whoever their partner is, I think is very empowering. And I love the idea that they can have the services with you from the PT perspective as well as the doula perspective, because I don't know, it's such a like a high trust space, and the more confident and empowered you can feel, I think the better the outcomes. So having that pairing seems ideal, and I think that that's great, for your clients that they get to have you in both facets. That's so cool. And I do feel like too, I mean, for me, my experience with the doulas, it was like she became part of the family. She was there for both
Yeah.
births. They're so close with you. She's close with my husband, and I don't know, it's a very special relationship I feel like you get to have with people in that space.
Absolutely. Yeah, I'm like however many years postpartum now. My most recent birth was 4 years ago, and I still talk to my doula all the time, and we don't even live in the same state. So
Yeah, that's a perfect example. Yeah, they become they're your close circle.
yes, yes,
Great.
totally.
Well, so given balancing both being a PT and doing working as a doula, can you tell us a little bit about like what your days look like or what your weeks look like? I know you were just kind of talking about coming
Yes.
off of a birth high. I'd love to hear a little more about that.
Totally. Yeah. So, today was not a typical day because I'm not usually at a birth overnight. I don't take a ton of doula clients just because I don't want it to negatively impact my ability to provide like PT patient care during the day. But my days are really, really great. Our work culture really values a work life balance and really values like our company filling our cups as therapists so that we have a full cup to pour from our patients. And I think that's so important, especially in today's healthcare.
Mhm.
So typically I see about 5 to 7 patients per day, and I see a super wide spectrum of pelvic floor patients, but I would say a majority of those patients either fall into the like pregnancy, postpartum um, realm, which can be a lot of different things, but
Mhm.
somewhere in that realm, and or menopause or perimenopausal
Okay.
um, patients. So those are probably the two biggest areas. The one area I don't treat is pediatrics, but I also do treat men. So that's kind of neat to add into there. So yeah, a wide variety of patients each day, all pelvic health related in some way, shape, or form, usually. I'm able to spend like 60 to 90 minutes with them, depending on the purpose of
Wonderful.
the visit. And so I have plenty of time to be able to like listen to them, hear what's really going on, and lots of time to like dive into their treatment and still have like plenty of time to do everything. So I really loved that my days are not rushed with my patients, which is
Mhm.
so great.
Yeah, I think that that's awesome, and I know for myself being on the receiving side of that, it's so nice to not feel rushed and to get the
Yes,
time to, talk through everything and have time to ask questions, and yeah, I think it's a huge benefit from the patient side as well.
totally, totally.
Right. So I know, pelvic health, I know that we're having increased awareness of it, but that there's still a lot of folks who either aren't aware that, that it's dysfunction of medicine or don't really know kind of like what all it includes. Can you tell us a little bit about how would you explain the importance of pelvic health to someone who either doesn't know about it at all or maybe has a very minimal understanding?
Yes, totally. So, I frequently say that anyone with a pelvis can benefit from pelvic floor therapy. So that's literally everybody, because our pelvis is at our core and it plays such an important role in so many areas and functions of our body that people just don't even realize. And so, um, that's one thing that I'm constantly trying to spread the message on is that like pelvic floor therapy isn't just for, pregnant people or just for people who are leaking. It's for anybody who has a pelvis. And chances are there's some point in time in your life when you're experiencing some kind of like pelvic floor issue, big or small. So,
Mhm. Great. Yeah, I appreciate that because I know it can, yeah, I don't know. It's one that I think can feel abstract to folks if they don't have that understanding. So I think that really helps to make it more familiar.
yes, yes.
When I also love the fact that it's like everyone with the pelvis, because I know with some people I talk to too, it's like, oh, this is only a women's thing, or it doesn't apply to men. And it's like, no, yes, it applies to everyone.
Yes, literally.
Another thing I'm curious to ask you about is what you encounter as some of the common misconceptions around pelvic health.
Oh my gosh, where do I even begin?
I
I feel like
imagine
I've
it's a long
spent
list.
yes, such a long list. I feel like I've spent my entire career trying to just, like, educate the world on, all the misconceptions about the pelvic floor, all the different myths that are out there. So, I think some of the big ones that, like, jump into my brain right away is that, like, pelvic health and pelvic floor therapy isn't just all about doing Kegels, and oftentimes, like, even if somebody is doing Kegels, they're oftentimes not even doing them correctly.
Yeah.
And it's just like it's a whole thing. And then the other big thing that jumps to my mind is that pelvic floor symptoms are really common, but they're not normal. And so, just really helping to bring that awareness to people that these issues can be seen frequently, but that doesn't mean that they're normal to have. Um, Other myths are like it's only for women, like we had said earlier,
Mhm.
but in fact, it's also for men and it can also be for children, depending on what they have going on. Um, Another big one is having pain with sex. I feel like I'm constantly breaking the stigma of like,
Mhm.
you shouldn't have pain with sex and you should be able to be aroused and have an orgasm. Like, you deserve to have a great sex life
Mhm.
without pain. So, um, and then another big one too is that that surgery is the only option for things like prolapse or endometriosis or whatever. And it's like, no, there are other options for helping to manage those symptoms before, especially for prolapse, before we need to like immediately go to, surgery or hysterectomy or something like that.
Mhm. I think, I mean, you touched on so many, which I think are all really powerful, for people to know, because I do think we hear a lot of those things commonly.
Yeah.
I know, like, in a lot of media articles, it's like, do Kegels and like, here's how to
Right.
do them. And you see it everywhere. It's so pervasive. But then also things like prolapse, that's something I've experienced personally. And I do see a lot of folks who might be hesitant to seek care because they think surgery will be their only choice and they don't want to have surgery, at least not at that point in time. And I see it hinder a lot of folks from reaching out and getting the care that they need. And so I think it's so important to hear things like that, that it's not the only choice. And there are many options for not only prolapse, but other conditions as well. So yeah, the
Yeah.
more we can talk about that, the better.
And I think there's just so much fear around the conversations that are had over those, like, symptoms and diagnoses, and so
Mhm.
being able to kind of break them down and not have so much fear placed in talking about them,
Yeah.
and just really providing knowledge, like, knowledge is power. So,
Yeah.
yeah.
Yeah. I think that that's huge. Well, and the stigma, yeah, it's interesting too. I think there's also like the stigma of needing to see a pelvic floor physical therapist. I was just at an event, it was a networking event last night. And I was explaining to people, my company and what I do. And the person I was talking to turned to someone she worked with. She's like, oh, well, you had a baby. Like, did you need to see a pelvic floor physical therapist? And she was like, her response was like, no, I was fortunate. I didn't have issues. And it was almost like a sense of pride that she didn't
Mhm.
need to see a pelvic floor PT. And I was like, man, how disappointing is that? That's like
Yes.
I mean, one, it was great we were talking about those kinds of topics, but it was a letdown to hear that it was more of like, oh, I didn't need that. And I'm like, okay.
Yes.
So it is
I
interesting.
Oh, go ahead.
No, I was just saying it's interesting to like when that's kind of the tone of what people's perception is of
Yeah.
that.
It's so interesting that you bring that up because I feel like that's something that happens frequently, but I don't know that I've ever had like a conversation around this topic before. But as a pelvic floor therapist myself, when I hear that like statement where it comes from a sense of like pride, like, oh, I didn't need pelvic floor therapy,
Uh-huh.
um, it just, like, breaks my heart because I'm like, "Oh, what did you miss out on? What are
Hmm.
you maybe" and not to say, I mean, there really truly are people who don't need pelvic floor therapy, like, they're genuinely doing great,
Yeah.
but there are a lot of people who just are not doing parts of their life because they, can't for whatever reason, because
Hmm.
of probably some symptoms. that maybe could be resolved with pelvic floor therapy, but
Mhm.
that sense of pride is kind of like standing in the
Yeah.
way, and they just don't know, you know,
Right.
it's not of any fault of
Yep.
their own, but yeah, so
Right.
I
And
love
what
that you brought that up.
Yeah, and I feel like too, it's like, oh, okay, if I'm not like leaking or having these major things, then pelvic floor therapy won't benefit me. When it's like, oh no, maybe like your low back pain or something like that is it's all
Yes.
tied to your pelvic floor and that could potentially help you. And I also think having that mindset going into it is challenging because as things change over the course of your life, I feel like having an ongoing relationship with the pelvic floor physical therapist is so beneficial because you just already have that trusted resource who can kind of help you monitor your body and adjust things as you go and be more proactive versus always being reactive. So yeah, it was
Yes.
I don't know, it was an interesting conversation and it was one I kind of left being like, I wanted to talk to her about all the benefits of pelvic floor physical therapy outside of I had an issue postpartum and now I need to see one.
Yes. Oh my gosh, I
Yeah.
also love that you just brought up, like, having a pelvic floor therapist, like, as somebody who, like, you see throughout seasons of your life, kind of like your dentist, like, you're checking back in with
Yep.
your dentist on a regular basis, and maybe it doesn't need to be that regular with a pelvic floor
Mhm.
therapist, but you're so right, like, if, maybe you're in the season of, like, pregnancy and postpartum or trying to conceive in you're in your like 20s and 30s or early 40s, but then we start to see symptoms of perimenopause set in, and so many
Yep.
women just have no idea that those symptoms can start in their like later 30s, early
Mhm.
40s, and last through their 50s. Menopause is just something we think of when we get older,
Right.
but there's so much like help and hope to be had along the way through that journey that can really
Mhm.
bring about so much quality of life. So I love that you brought that up.
Yeah. Yeah, that's why I tell anybody, I'm like, "Just you see one now, check it out, keep it in your, like, toolkit, things you're seeing on a
Yes.
regular basis because
Yes.
it can help with so many things." One another question I have for you is, I know, of course, everybody's, like, unique in terms of what's going on in their body, but are there a few tips that apply to a wider population as far as good pelvic health habits that you could share?
Oh, definitely. So here are a couple of my like top things that I'm always recommending. First of all, like learning to breathe better and just learning about how you breathe. It's something that we just do all day, every day, and we don't think
Mhm.
anything about it. But so many people are breathing poorly. I myself was breathing poorly. I still do sometimes breathe poorly. And that can have such a profound impact on how so many body systems are working, including our pelvic floor, and our nervous system, our gut, everything. So, breathing better is, I think, one of the number one tips I would say. Another like global tip I would say is to tune into your body and stop clenching your glutes or your jaw or like your toes, those different areas of your body that sometimes hold a lot of tension. Like we subconsciously are just always tensing up all these weird areas. Usually, when your glutes and your jaw or your toes are tense, your pelvic floor muscles are also tensed up too. Um, I would recommend making sure that you're pooping daily and getting a nice, like, big bowel movement out. So you're like completely emptying your poop on a daily basis. I have so many people who come in and they're like, well, I poop like 3 times a week, but I've done that my whole life. So my doctor says that's normal. And I'm like, but is it? Maybe we should investigate that. How would that impact your prolapse symptoms or your
Right.
pain with
Yep.
sex? Um, and then the last 2 things I think would be to integrate, like, daily exercise that's meaningful. So, many people have such a hard time, like, getting in activity, and I think a lot of times it's because it's something that they're, like, forcing themselves to do. So, I really encourage people to find
Mhm.
meaningful exercise. Motion is lotion. And my last and I would wanna say this is my favorite thing, but all of these things are my favorite things to tell people, is to not be fearful of pain and discomfort when your body is not feeling well, but rather to, like, allow it to be a way that you learn about a change that your body is requesting. Like, we can learn so much from having symptoms if we are really tuning into them to see what our body is asking and requesting of us. So,
Mhm.
those are some of my
I love
favorite
that one.
things.
Yeah, those are the I yeah, I've got thoughts on all of them. I love the last one because I feel like for me, a lot of what I experienced postpartum with my second was so much low back pain, like, and for a long time, And I feel like I worked through it with my pelvic floor physical therapist and other folks, it was like a lot of like the strengthening like that was needed. It was like my glutes were really weak and stuff like that. And it was like by tuning into that, I was able to have good conversations with them, and then they could help provide good direction for me as far as what to address, and then, help work to mitigate that over time.
Yeah,
Um,
it's amazing. Our bodies
yeah,
are
so
so smart.
I know. And it does take time, right? To like pause and listen, and versus just being like, oh, I feel bad. It's like, well, what really is kind of bothering you, and tuning into that and taking that time to just take a few minutes. I think especially with how busy we are anymore, especially if you have kids, it can be hard to kind of pause and reflect on, well, what is going on with me right now?
Yes,
Uh,
yes.
The breathing one is also something I was thinking about, because I know, in preparing like for the birth of my first baby, I was reading a lot about like how do you prepare, and breathing of course is like such a huge piece of that. And it was interesting because my husband is a musician and he teaches as a choir director. So breathing for him, he was very familiar with. And so I'd be like telling him about these different breathing techniques. He's like, oh, well, Lauren, you need to be like, you're not expanding enough down here, or you're not like holding your mouth right, or you're not doing the full exhale. And so it was so interesting for he and I to work through that together, but then him to be so familiar with, proper breathing techniques and how the diaphragm works and all of that. So that was been an interesting one for me to learn about at the beginning
Yeah.
of that, and then try to keep in mind, now.
I bet that was an interesting bonding moment for y'all.
Yeah, for sure. I still remember because we were doing like, he was at a conference and I'm like reading my books and we're just like chatting, and he's like, oh yeah, for that it's this and this it's that. And I was like, okay. But we were able to really get into it together because he was so familiar with exactly, what they were talking about.
That is so
Yeah.
cool.
Yeah, it was neat. Okay, so another thing I wanted to touch base on is, and you started to talk about this a little bit with the different types of clients that you see. Um,
Yeah.
Talking just a little bit about how pelvic health comes into play at the pregnancy and postpartum, and then in that perimenopause, going through menopause, part of someone's life.
Yes. Yeah, during pregnancy, I feel like oftentimes we're either addressing any existing symptoms. So maybe there are things that were going on before they got pregnant, and now pregnancy just naturally amplifies everything,
Yeah.
brings out all the little things to light. Or being proactive with how their body is progressing through their pregnancy, in order to be able to maintain their activity level and stay moving comfortably through pregnancy, as well as like preparing for labor and preparing for birth and those like early postpartum recovery days. So there's a wide range of things that you can work on during the like pregnancy season. Um, and then shifting into postpartum, there's the big things like recovery of all the things that happen during pregnancy and birth. So, any of those lingering symptoms from pregnancy,
Yeah.
as well as like diastasis recti, prolapse, bladder and bowel function things, returning to sex postpartum, because that's
Mhm.
a whole wild ride.
Yeah.
And like that first postpartum poop, resolving any back pain, and even like, oftentimes we think about the pelvis being the pelvis, but it's really the whole body. So, like, even things going on up the spine, like neck and shoulder, especially when you're looking at your cute baby all the time,
Mhm.
and like sleeping in weird positions. So, taking like a whole body look at everything rather than just in the pelvis itself. And then just progressing right into like perimenopause and menopause. For menopause, specifically addressing some of the genitourinary symptoms of
Mm.
menopause, which is like a whole laundry list of things that can start to sneakily present themselves during that year. But also during menopause, working with women in order to get them back into their like exercise and strength training so that they can prevent things like osteoporosis and improve like their metabolic function through strengthening. But so many of them are not strengthening because of things like leakage, prolapse, pain, or maybe they just never
Mhm.
did that before. And so they're
Yeah.
afraid to try something new when now they're in like the second season of life.
Yeah.
So again, a really wide variety of things.
Mhm.
And, yes, the pelvis is the hub, but it's a whole body issue.
Yeah. Great. Thanks for sharing that. I do think it's helpful for folks to hear, depending, I know people hearing this will be at various stages of life, or know people, of course, at various stages of life. So I think the more we learn about how this comes into play at those different, milestones, it's really helpful just to have that better understanding. So thanks for sharing that.
I think if I can add one thing in there
Of
too,
course.
and this is not an area that is my expertise at all, but I feel like it's worth mentioning because you never know who is listening. There is a whole area of pelvic health for pediatric clients as
Mm.
well. So kids who are having issues with potty training, constipation, bedwetting, all of that kind of stuff, issues with like core stability, it all kind of comes back to, okay, like what's going on with their like motor development and their core and how their pelvic floor is initially learning to coordinate. And really, if we can address some of those things at a pediatric stage,
Mhm.
like how much are we going to set our kids up for success once they're adults? And then going into things like pregnancy or menopause, if they don't have this history of 40 years of constipation that started when
Right.
they were 2. So,
Yeah. Well, and I think that's a great point.
yeah, yeah.
Yeah, I really love that because I know, like, for me, having experienced prolapse, which I didn't know about, before I had it, I'm extra sensitive to like my girls, like with potty training and like not straining and managing constipation and all of those things. And had I not experienced that, I wouldn't have that. I know I wouldn't have that same mindset with how I kind of watch and monitor and teach them. So it is interesting, like where I've kind of gone through this hard thing, but now have this learning. So I think hearing about that and knowing that there's resources available for kids and pediatrics is great as well because I don't think you hear about that as much.
Yes.
So
I
yeah,
I have a question for you,
of course.
kind of on that same topic. Do you feel like because you've been able to, like, go through some pelvic floor things yourself, with your history of prolapse, has that helped to influence and shape how you're teaching your girls about their body? And, I know you shared with me that they're still pretty young, but how you
Mhm.
plan to, like, talk them through, like, their anatomy and when to have certain conversations, and just like maybe if we're again giving those tools and words to people younger, how that
Yep.
can set them up for success for even just being able to have conversations with their doctor when they're 20 and not
Yeah.
experiencing pain.
Yeah. I think it has definitely impacted how I talk with them. Um, and it's funny that you asked that because so my husband and I both are very like pro using anatomically correct terms and talking about their body parts and talking about what's appropriate and what's not for them and other people. And it's so funny because so the girls, like whenever we go visit our in-laws, um, Harper will be like, "Oh, I need to use the restroom or I need some toilet paper to wipe my vulva." And my mother-in-law is just like almost in hives. And she'll be like, "Oh, do you need toilet paper to like wipe your baba?" And she's like, Harper, my oldest, she's like, "Nina, that's not what it's called. It's a vulva." And she's like
I
yelling it at
love
her.
that.
And so yeah, she's like, "Nana, I don't know what a baba is. It's my vulva." It's
I
like my
love that. Look at
mother-in-law.
your girls are teaching like the
Yes.
older generation. That's amazing.
Yeah, it's been great, and I love my mother-in-law to death, and she's just like, "Oh my gosh." It's just but it's funny because Harper is like, "Yeah, this is my vulva," and when she's talking to her younger sister, like, as she just recently is going through learning how to use the toilet and those kinds of things, they can have, very real conversations, and it
Yes.
has been important, and it's even interesting, like, when I'll use my pessary, like, explaining to her what that is, how it provides support for me, and
Yeah.
talking about the pelvic floor. And like my oldest does deal with some constipation. And so it's something we've had to be really careful about and explaining to her, hey, don't push really hard and why it can be challenging. And it's cool to see, with her at 4, where she can really start to understand some of those things and change her habits. Like at first we were approaching a few things like not in the best way, and we've since course corrected, and you can see her course correcting and being like, okay, I don't do those things
So
anymore.
cool.
Now I do these things and I take my deep breaths and like let things come out. And
Oh,
yeah, had I not had prolapse, it would have been a different
a
story.
different story. Oh, that is
Mhm.
so amazing.
Yeah. So vulva not baba
Love that. Love
at
that so
our house.
much.
I did want to ask you, can you just tell us a little bit about what you feel like is the most rewarding parts of your job?
Oh boy, yes.
I know that's probably a long list too.
Yeah, no, honestly, it is like getting to have real conversations and like form real relationships with other women and then getting to see their quality of life improve. And just getting to have like a front row seat at that. Like it makes me teary thinking about it, but I've gotten to see so many amazing um like transformations or like things happen in people's lives because they were able to, you know, address whatever their symptoms were and to be able to have a front row seat at that
Yeah.
and get to walk alongside people like people are always like, oh my gosh, you're doing so much for me, and I'm like, I am just giving you the tools, you are doing all of the work, and it is such a beautiful thing to see them
Mhm.
get to like work through that and the blessings and joy that it brings them.
Yeah, and it is huge. It's going through it myself, it's transformative, it's life-changing, and having that support from people like yourself, it's so impactful. So I think it's amazing the work that you do and continue to do. And I know I appreciate it as well as anybody else that gets to come into this space for sure. Great.
Awesome.
Well, I'll wrap us up here. Is there anything else, any parting words you'd like to leave us with as we wrap up?
I think if I had to leave with any parting words, it would just be that there is hope for whatever is going on with your pelvic floor, and that there's help out there that is like effective and doesn't have to be like solely just like surgical or pharmaceutical. So really
Mhm.
just wanted to leave on it on the word of hope.
Which I really appreciate because I know for a lot of people, that's not how they feel, especially at the beginning. And it's good to hear that that is, where their path can lead is somewhere confident and hopeful. So thank you so much, Allie. We really appreciate your time today.
Thank you for having me. This has been fun.
Great.